Welcome to healthreform.gov. If you turned into President Obama's first State of the Union speech, you heard him deliver a powerful message to Congress about health insurance reform. Do not walk away from reform, he said. Not now, not when we are so close. Let's find a way to come together and finish the job for the American people. A year into his presidency, it's worth remembering just how close we are to finishing that important job. We have strong bills that have passed the House and the Senate. Both bills would cover tens of millions of Americans, end insurance company abuse, create a new health insurance market where every American could get affordable coverage, slow the rising premium costs, and lower the deficit by as much as $1 trillion over the next 2 decades. As President Obama pointed out in his speech, reform has broad support among people who know our health care system the best: doctors, nurses, and the experts who study health policy for a living. Most of all, we know what will happen if we don't pass reform. Millions more Americans will lose their coverage. More and more small businesses won't be able to cover their workers. Premiums and copays will eat up a growing portion of your paycheck. People with insurance will keep worrying about losing it. And people without insurance will continue to worry about going bankrupt if they get sick. We have come too far, and health insurance reform is too important to give up now. It's time to finish the job. Thank you for visiting healthreform.gov, and be sure to check back often for our latest updates.
Next week, on February 25th, the Obama administration is going to take one more shot at trying to get health care reform through. He's invited 21 leaders from both Senate as well as Congress to try and actually convince them that this is the right thing to do. Nobody will disagree that we need to reform the health care system, but finishing the job, as Secretary Sebelius said yesterday in her video, actually is not what's enough. It's getting the job done right. That's the most important thing. Some of the points that she mentioned yesterday are probably not on point. Number one, simply providing coverage for everybody is not enough. Nobody will disagree that we have to have coverage for every individual in the United States. But it's not enough to just mark the box off and say that we have coverage. What's going to happen to the 20-year-old who's obese, who might have diabetes several years from now? Is he going to have the right coverage that we provide today? Is it enough to say that we're providing some coverage? Probably not. And what we're not factoring in is the health risk of the individual and the likelihood of what they're going to use in the future. The CBO doesn't score that. And that's such a major flaw in terms of how we're looking at coverage and making sure that everybody has not just coverage, but the right coverage. The second thing refers to actually insurance abuses. Last week, the administration went after Anthem because they raised their premiums by 39%. Now, insurance companies need to be held accountable. But guess what, America? The insurance companies today are accountable to employers who are paying them every single day to administer the plans for their workforce. It's not the government. It's not the government's role to step in and have to hold Anthem or United Healthcare or anybody accountable. We have to sit back and reflect on what our system is today and make sure that we incentivize and encourage employers to hold the insurance companies accountable. That's a very important component to this. The second piece is about choice. Nobody's going to disagree that we as individuals need more choice. It would be great to be able to purchase insurance across state lines, to be able to choose insurance carriers in other states, but that takes money. There are many pieces we've got to put in place in order to make that happen. Imagine if you wanted to go and buy airline tickets or go to Amazon, but you didn't have a computer. That's what we're suggesting today in talking about this make-believe marketplace, which in theory sounds good, but we haven't factored in the cost and all of the pieces that have to come together. The investment that we've made in health information technology doesn't even scratch the surface in terms of the infrastructure that's required to actually make these marketplaces work. The next piece that's really important is about slowing the premiums and the rate of the premium increases. No arguments there. We've got to bend the curve, but not just for the short term. Otherwise, it's going to boomerang right back. What's really important is not looking at just the cost of the individual, as I said earlier, but the cost and the risk of the individual to make sure that we're understanding not just the illness, but the people with illness and what they're going to cost the system. Let's put in place the accountability and the purchasing power for employers and for consumers to get all the right information, to hold insurance carriers accountable, to hold pharmacies accountable, to hold disease management programs accountable, everybody within the system, and ultimately provide the right incentives to doctors to do the right thing and to provide the right care. And yes, be able to eliminate fraud and abuse without the necessary government intervention that's required. Secretary Sebelius and the President say that we are ultimately going to reduce the deficit by $1 trillion, over $1 trillion. And that's what the CBO has scored. Nonsense. Because there's no element of the cost required and the infrastructure required to put in place all of the pieces to ultimately reduce cost. It's not enough to simply provide coverage for most of the people who actually aren't going to have the right coverage for the future, and we haven't factored in the pieces that are going to be required to make any of these plans ultimately successful. It's important to be honest to the American people about what this bill is really going to cost, and perhaps in the near term, it won't be deficit neutral. And let's be honest with the American people that for the long term, perhaps we'll have a better plan that ultimately will provide better coverage, ultimately will reduce cost, and provide better care. It's not just about finishing the job, it's about getting the job done right. And let's hope that on February 25th, the President can actually accomplish something now and get health care done. Thank you.